Good morning, everyone. If you can hear me, do you mind raising your hand? Oh, so good to see you all. I miss seeing everyone in person. Welcome to our quarterly HOA meeting. This is going to be a little different than what we've done in the past. We appreciate you attending our first virtual quarterly HOA meeting. As you can probably tell from our agenda, we're going to do it a little different. We have two parts. The first part, we're going to cover a COVID-19 response. Our Assistant City Manager, Doug Brinkley, and our Fire and EMS Chief, Doug Boker, will provide an update to you all, and then we will have some time for questions. Then we'll take a little break. Then we'll go into part two, where we will cover some other topics such as an engineering update, an update for Treasury, economic development, as well as engineering. And then we will also have the Census 2020 update. So we appreciate you all being here this morning. We have a lot of important and helpful information to share with you. I'm going to go ahead and share my screen. So hold on just a moment, please. Okay, throughout this meeting, we will be taking questions, but to start out with, we would like for you to please enter any questions that you may have in the chat section of Zoom. And for those of you who are new to Zoom, if you wish to ask a question, what you'll do is scroll down to the bottom part of your screen, and you will see the chat button. You'll click on it, and then off to the right side, you'll see a Zoom group chat where you can enter in your question. Now, we will not get to the questions until Doug Brinkley and Doug Boker have both completed their presentations. And then if we have time, we will be taking questions verbally, and I will show you all how to do that after their presentations. So we'll go ahead and get started. I'm going to kick it off to Assistant City Manager Doug Brinkley.
Hey, Carrie. As soon as you did that, I lost my presentation. Hold on a second.
Doug, can you see my screen?
Yeah, I can see your screen.
Okay. You just let me know and I can forward the slides for you.
All right. So I think, good morning. How's everyone doing? Just nod your head. I'm going to give you a brief overview, kind of how we got here, but more importantly, focus on what the impact has been to the city currently. So first couple of slides are just a timeline. You can go to next slide for me, please. This whole thing kind of unfolded for us right around the end of January. We started seeing the spread of COVID throughout the nation. We were one of the first ones that stood up the Emergency Operations Center to start monitoring, and it had maybe one or two persons in there, our emergency management coordinator, Pat Hughes, and one or two other staff. And that was just to keep the pulse of what was going on. That's when we really started doing public information, basically just talking about what is COVID, how is it spread, and actually offering some protection tips, and also sharing some of the authoritative sources where people could go. And that's both for public facing, but also for our employees here as well, too. And we were hopefully ahead of the game at that time. Right around February, Dr. Anzadula started providing employee training, more information about the disease, how it's spread, and things we do to protect ourselves and also the public in turn. We began participating in some of the local, state, and national briefings on COVID response, and that was good to make sure that we started to coordinate our efforts at all levels of government. One big thing is we started stockpiling personal protection equipment. We knew from the start of this whole thing, and I think Chief Walker will talk about this a little bit, as we probably wouldn't have enough N95 masks for our first responders. Typically, those are the men and women who have that first line of contact with the public, fire department being especially at risk because oftentimes they're called for medical emergency through the EMS transport. And we were trying to make sure that we had their PPE to protect our men and women, especially in the fire service, but also police department and any other department that had that first contact with the public. We began developing workforce reduction contingency plans with the eventuality, if we started losing employees to COVID illnesses, and we're starting to see that now in the last 30 to 45 days, we've had a few employees who are succumbed to the COVID illnesses throughout the city. What will our response be? Will we start to limit some of our essential services and actually focus just on COVID? Each department was tasked with making sure they had a plan of action. If you lost 10%, 20%, 30% of your workforce in your department, what would you do? What services would you reduce? And how would you keep service for city essential services throughout this COVID event? So that we kind of started those discussions, actually laying those plans out early in the year. In March, you started seeing various states, New York, of special note, began declaring states of emergency. And obviously at that time, what they're doing is clearing the path and make sure they can receive federal funding, but also federal aid if the need arises. And actually that's exactly what happened over the last couple of months. Our Emergency Operations Center kind of ramped up. We were staffed and fully operational in the early parts of March. And we started to limit non-essential services and focus entirely on our COVID-related response. Just about every department in the city had a representative in the EOC. What was kind of unique in this format is everything, or a lot of it was virtual, although we had maybe 10 or 15 people in the EOC. That was vastly reduced to what we normally would have had. Around the same time, President Trump began releasing federal funding for COVID response nationwide. If you remember, also around this time, the CDC started releasing social distancing guidelines. That's when we started talking about to wear a mask, not to wear a mask. That's when the 6-foot distance came in, and there was a lot of discussion around things we could do. And we still didn't know a very deep understanding of how it was transmitted. Around that time, or end of March, or mid-March, end of March, City of Sugar Land and also Fort Bend County issued disaster declarations, restricting bars, restaurants, and also public gatherings at that time. And I guess I should actually go ahead and forward that a little bit more for me. One more slide. So this moves us to April. One more slide for me, please. Thanks. Forgive me, still got to get used to this whole presentation on Zoom. So this moves about to April. President Trump outlined his Open Up America plan. If you remember, there was like a 3-phase approach to reduce the risk of virus resurgence. It had triggers for moving from each phase, and most of that related to a decrease or a decline in the COVID-related illnesses, but also deaths. I want to make sure that we increase hospital capacity nationwide to make sure if you are still, if you're sick, if you're ill, that we had ICU beds to make sure we can take care of you. And also make sure there was ample COVID testing, both COVID testing, but also antibody or antigen testing as well too. That was key and critical to make sure we can trace the path of the virus, see what the infection rate was, and actually try to get our government back up and running as quickly as possible. Most of the governors, the task was each governor to come back and present a specific plan, and the Governor Abbott quickly followed and presented his Texas-specific plan, and it's kind of modeled after Trump's plan. Present time, next slide. So that brings to today. We are, as you already know, we're experiencing a significant resurgence in COVID-related illnesses, also the deaths. In response, Governor Abbott has begun rolling back some of the restrictions, closing bars, limiting public gatherings, but also requiring everyone to wear a face mask in public places, also if they enter in commercial buildings. And a lot of that discussion is still ongoing. We're still looking for the governor to roll back and make some further restrictions. Next slide. So what has been our response? I won't go into everything, but I'll give you a highlight. We've always been working collaboratively with the health officials and also medical community. We do have a team, generally out of the fire department, that work as a liaison between the hospitals to examine the hospital capacity. What's the bed rate for medical and surgical procedures? What's that ICU bed rate or capacity as well too? We want to make sure that we are working with the health officials so we can meet the needs of our community. If we need or they need to stand up a mobile hospital, can we assist them? Can we expedite any permits they need? Can we provide safety and security, traffic plans? There's a role for us to be a partner with our medical community to make sure that we can have and easy access to medical services for our residents. We're doing everything possible to keep our employees safe, provide them with the needed personal protective equipment as far as masks, disinfectant, make sure they can do their job, but also continue to provide city services to the city. And that's one of our main priorities as well. We've offered mental health counseling services, make sure you debrief around some of these instances. And I said it before, we've had a few employees throughout the city who have come down with COVID-related illnesses. And we do have a team of employees going through the HR department, but also through our SISM team to make sure we collaborate with our employees and make sure we care for their well-being. We have established a team of employees from police, fire, code enforcement, our legal staff, and also economic development when ensuring compliance with Governor Abbott's executive order. And that's been one of the important things over the last 45 to 60 days. When those restrictions come out, we've had to make sure that code enforcement, police, the fire marshal go out to all the businesses, all the restaurants, make sure they are adhering to the social distancing requirements. And then Economic Development Office and Tourism has provided a comprehensive unified recovery plan. What are we doing to support our businesses to make sure that we get them back up and going? We've got to have an economy to come back to, and that's been one of our main focuses, to make sure that we provide that support to our business community. And that's ongoing. I think we're going to, actually I know, a big part of this whole thing is making sure we provide that support and keep our economy going. Next slide for me, please. And then this is the big one. I think the final two slides. What impact has it been to city services? So we have began to limit city services probably 2-3 months ago. Some of the basic one, animal shelter, is by appointment only. Issuance of animal traps has been suspended. Meetings, such as this one, quarterly HOA, any citizen engagement programs, Academy, Sugarland 101, Fire Police Academy, they will incorporate social distancing requirements. City Council, P&Z, and other meetings are being held online. Parks and Recreations, facility reservations are on hold at this time. A lot of the amenities as far as basketball courts, splash courts, activities at T.E. Harmon Center have been closed. Next slide for me, please. Police department, it's kind of hard to shut down your first responders, both police and fire, but they have limited some of their services. So they've limited fingerprint services, that's been suspended. House watch has been suspended temporarily. Fire department, still on the front line of emergency response and actually transport. Most of the activities are ongoing. We've kind of increased the readiness level for fire department, make sure they're wearing those personal protective masks, make sure they're going through the medical protocol when they get calls for service. What's the signs? What's the symptoms? Is it or could it be COVID related? Make sure we prepare our men and women when we're responding to residents as well too. To that end, they've reduced or eliminated some of the smoke alarm installation and home safety surveys. Community events requests for Sugarland Fire Department have been suspended. However, they continue to do drive-by to parades by request only, and we're asking everybody to have a 2-week advance notice. And I've seen them do that over the last couple weeks. Municipal court, all jury trial cases suspended or canceled through September 1st. However, pretrial hearings are being conducted in the court with social distance guidelines. Next slide. Water service and payments. City of Sugarland will not disconnect your water service, and I believe that's through August. However, you still have to pay your bill at some point. Treasury office staffing has been reduced. We're asking everybody to call into Treasury if you have any questions or you need assistance. Payments definitely can be used online or the drop box in front of City Hall. That's been pretty well received, to be honest with you. We thought we'd have a little more pushback on that, but people are really getting used to the online services and also the appointment only. It's needed. Building safety, both permits and also inspections, staff levels have been reduced in both of those departments. Permit application will be delayed. We're asking everybody, give us about 5 days to process your application for a permit. If you haven't heard back from us, then call into the building safety department. So, and then next slide for me, please. In person, anything come to City Hall, we're doing by appointment only. I talked a little bit about building safety, permits, and also inspections, but City Secretary, Treasury are accepting in-person customers by appointment only. You have to go to a screening, health screening. Basically, we're taking your temperature. Right now, since the last executive order from the governor, we are requiring masks as well too. And all this is to make sure we protect our residents, citizens coming into the City Hall for services, but also our employees. is really important to protect our employees, to make sure we can keep city services up and going. Thus far, we've been able to do that with some basic precaution methods, but we continue to use the CARES funding to make sure we have adequate PPE and other resources we need. So next slide. And I was asked to keep this pretty brief, so when there's an opportunity to take questions, I'd be more than happy to do so. If you have any specific questions reference what we're doing related to COVID, or also the Emergency Operations Center. That's the end of my report.
Thank you, Chief. Again, if you all have any questions, if you wouldn't mind entering those into the chat section of your Zoom screen, and we will get to those following Chief Boker's presentation. Okay, hold on just a moment, and I'll kick it off to Chief Boker.
All right.
All right, Chief, you're on. Thank you.
All right. I think I got it figured out now.
Yes.
When it's facilitated, there's a few extra mute buttons I have to navigate. So, I don't have a PowerPoint. What I wanted, when I talked with Gary about this, what I wanted to do is have a conversation just to let you know how your fire department is responding and kind of where we're at. And I'm going to try something a little unique where I'm going to try and change my backgrounds to show you some graphics that we use in our daily planning. And it'll either be a huge hit or it won't. And we'll go back to PowerPoints. So, but I report to Doug Brinkley. And so we've worked very closely on the COVID response. And so for us in fire, this kind of started with the travel restriction conversations at the national level. And there was a new law that was passed last year that regarded government tracking of citizens for healthcare issues. And so early on, late January, there was conversation. And in February, we started updating our PSAP, which is a public safety answering point. It's essentially 911. When we would get reports from Health and Human Services of COVID positive patients. And this was brand new. It's a law that it had been passed but never followed, and that was kind of how we got thrust into COVID, arguing and trying to make sure that we were ensuring privacy rights of citizens. And so you get into a fire department, put out fires, and all of a sudden we're legal analysts and trying to navigate a PSAP issue. So we got to work on our PPE, and we noticed that the supply chain right away was drying up. We ordered everything we could. And just to put it in perspective, when COVID started, we had about 1,000 N95 masks on hand, which for normal operations would be about a 10-year supply for us. So we had a very robust supply of PPE, but we started seeing our burn rates go up dramatically. And where we were using a couple of N95s per month, and then all of a sudden we were using 50 a day. And so we knew we had to do something drastic, and we started working on contingency plans. And so the first thing that we did was we moved to daily reports of our usage. And so like behind me, you can see that, this is backwards, you can see the big spike that we had as we started tracking N95 usage. It went way up in the middle of March. And so the initial reductions that we had, we changed our practices. CDC was constantly updating the best guidance. And they went from a very conservative stance that it's one use, one mask, one patient, and very formal, to where now there's organizations that have a 5-mask cycle going on. They decontaminate them for 4 days, and then the 5th day the employee's back in that mask. We never had to do that, although we were issuing masks and telling them to wear it until they came across that patient. But at the same time, we updated our respiratory protection and moved into PAPRs, which is a powered unit. So we always had definitive care. That was like our biggest concern, was the protection of the employees. And as that became harder to ensure, we had to look for plan B, plan C, plan D. So we always had about 4 plans for protection. Some of them didn't look very good. We wear medical gowns, and gowns actually are harder to get than N95s. And pandemic pricing was pricing us out of the market on some of this. An N95 mask we previously paid 73 cents a mask for. At the peak, we paid $5.50 per mask. And we're back now to buying through traditional supply chains and getting them at much better prices. But gowns just never really came through. Production of gowns didn't go up. So from gowns, we went to splash aprons like you would see in a chemical plant. Plan C was raincoats, heavy duty raincoats, until finally the 4th plan was level B hazmat suits. And so we bought hazmat suits that are encapsulated where we could put our employees in firefighting air packs with a hazmat suit around them to send them in. And that's the radical approach that we took to make sure that we always had protection. That was the one thing I could always guarantee my bosses: we will never face not being able to protect our employees, which was a hard thing to say early on because there was so much unknown. With the planning on PPE, we had to figure out how to keep them clean. And so COVID, for what we know now of COVID, just a few short months ago, we knew almost nothing about COVID. And so we found some commercially available products that would clean ambulances, fire trucks, PPE, and people. And we used a product called Cavicide, and it was about $26 a gallon. And so the first couple of econs we did, we were burning through a gallon of Cavicide, and the $26 wasn't the tripping point for us. Is if we only had 16 gallons on hand, and 16 gallons would last us 20 years probably in normal operations. But when you're putting it in a pump can and spraying the inside of an ambulance to ensure that the next customer doesn't get infected by the previous customer and keep our crew safe, the burn rate was enormous. And so we ordered a product called Aeroclave, and it's expensive, but it was also back ordered. And we just got it. We ordered it in February. It came in about 3 weeks ago. And so I sent it up to logistics and asked them, I said, what's it do? Figure out what it does and figure out an alternative. It was kind of like the Apollo 13 thing. Figure out what we have that we can make this happen. And the guys came back saying, like, you're not going to like this, but essentially it's a mosquito fogger. and so we went and bought commercial mosquito foggers, and we used a product called N95, which is water-based, so we didn't blow the whole city up. And the difference between Cavicide and N95 was 2 things. 1, it was available, and 2, water-based and safe. And so we started spraying our units with mosquito foggers and N95 that we would buy in concentrate. And we have several thousand gallons of N95 solution on hand now as our stopgap. We've since moved over to a product called Vital Oxide that has a 1 minute kill time like Cavicide. The N95 had a 5 minute kill time, which what that means is you have to spray it and leave it wet for 5 minutes, and then it kills the virus, and you go through and clean it up. So we have a variety of cleaning products now that we use. And we actually moved over to a modified paint sprayer at one point, and this is what that looks like when these guys are. It's hard for me to navigate. They put their PPE on, and they're actually spraying the inside of the ambulance between every patient. And so this was a good setup for us because it was portable and it allowed them to decon their own units in real time. We would send an engine out to meet them at the ER dock because engines have air compressors built into them for the air brakes. And so we could work straight off of the pump panel of the engine and spray the inside of the ambulance, and they're back in service. The problem was that the product we were using has started to fade our $330,000 ambulance interiors. And so it was a great thing short term, and it got us through the COVID push. we've now moved on to a different product that is a little more, a little better for our interior finishes on the ambulance. As the calls changed, we worked with dispatch to try and give our guys a heads up of what they were getting into. And I'll just tell you, we're kind of back now to where we started. Dispatch just kind of tells us to go to a call, we go, and we have to figure it out when we get there, because the CDC's latest guidance is it's about 18 questions that we have to ask to figure out if this is a potential COVID positive. And it's just too much for dispatch to go through. And if we ask those 18 people, there's 33 people on this call. If we ask those 18 questions to 33 of us, probably 29 of us would trigger for some sort of a COVID symptom. So we treat every patient now as though it's COVID. Our guys are wearing N95 masks for every patient. And if there's any aerosol producing procedure that is done, or they're coughing or sneezing, then we put them in gowns, goggles, boot covers, the whole associated protection plan. So we've modified our response plan somewhat. We still send the same number of trucks, but we're a little less aggressive on making entries. So healthcare facilities, we'll ask the healthcare facility to bring the patient to us. And the idea there is time distance shielding, just like with hazmat. We want to decrease the exposure of the employee into an environment that's potentially positive because a patient's been positive. So healthcare facilities have been pretty good about helping us with that, bringing the patient out. And the biggest thing that does for us is it decreases our PPE burn rate. So if we're going in and doing all of the handling of a patient from a healthcare facility, we're going to have to send 3 or 4 people in. And so our burn rate would be about 400% of what it is now. Right now, we commit 1 person. They meet the facility staff that brings the patient out. They help us transition to our stretcher. We load the patient and our employee into the back. And our guys are there as a supportive, the rest of the fire crew is there as a supportive role if need be. And so it helped us get through the PPE push without burning PPE a whole lot faster than we would otherwise do that. We've continued that practice, even though we're short up on PPE, probably better than any other fire department in the county. We still want to be conservative with our PPE, and we want to make sure that we have a healthy workforce at the end. And the way that we've decided to do that is by limiting exposures for the long haul. If we go to a private house, we put out a video back in April, and it's kind of an interesting video. If you're bored this afternoon, you might go back to Sugar Land Fire-EMS Facebook page, and you can see a video we put out regarding what you should expect from your fire department. And the big thing we do is we knock and back up. So we'll knock on our front door, we back up 6 feet, and we're having a conversation prior to going in to help us assess what the needs are inside and what the PPE levels are, and also just to see if the patient can ambulate to the front door to start care by the front door, rather than going deep into a house, into a bedroom that possibly somebody with COVID's been sitting in there for 2 weeks with labored breathing, and there's a lot of contaminants in the room, and it helps us keep our equipment and our people safe. Deconning equipment is very problematic. If we take a stretcher and 2 ALS bags, a suction unit, a heart monitor, and maybe we'll take our auto pulse into a house, deconning all of that equipment is very hard to make sure that it's safe for the next person. It takes a long time. Our EMS calls have gone from about a 61-minute average to 180 minutes now. The decon process, so we're spending 300% more time for the same number of calls. And so the less that we can expose to contaminants, the easier the decon, the faster we're getting that unit back in service, and the faster we service the next customer. Another way that we're trying to service the customer is being on top of our destination points. And so this is a tool that we use, and it's SETTRAC stands for Southeast Texas Regional Advisory Council. we've been a member of SetTrack. It's a requirement through state government, through state administrative law. And this is our regional RAC SetTrack, and they do a tremendous job of aligning EMS and hospital needs. They've really done a great job of stepping up during COVID to exchange information. And I'll just tell you, no organization gets the information that they would like to get, but SetTrack's doing a much better job than most organizations are currently, than most other RACs rather, in trying to coordinate the information. So you can see this is an executive hospital summary that SetTrack puts out, and it tells us a daily trend and where patients are and where they aren't. Another tool, and this is a publicly accessible web page that you can actually go to if you're interested. This website, this page tells us who has ICU beds available, and it tells us the condition of our county as a whole. And so the day I snapped this picture, you can see that 56.6% of our ICU bed usage in Fort Bend County was COVID related. Yesterday it was down to 35%. And so every day there are some fairly significant swings in what resources are available. We also have a program called EM Resource, and this is not a public accessible page, but it's EMS specific page and allows our guys to look downline. If we're taking a COVID patient to a facility, they can see, if a facility is at 90% ICU usage, they might bypass the first name hospital and go to the second, because we can see downline that they have the ICU capacity to deal with that patient. So it's been a good tool for us. We've had some protocol changes. One of the biggest issue with COVID is aerosol producing procedures. And so that's anything that takes something wet from someone's airway and introduces it to the environment in a small particulate. And so to navigate that, we worked with a friend of mine who owns a acrylic and glass business. Actually, he owns a shower toilet business. And so he built us some acrylic boxes that we can put patients into. And this was a drastic measure. And I'll just in full disclosure, I'll tell you, if you're having respiratory difficulty, the last thing you want is somebody to put something over your head. This was a stopgap measure for us that protected our crews and enabled us to continue to do aerosol producing procedures while most other EMS agencies, matter of fact, every EMS agency that borders Sugar Land had gone to a no aerosol producing procedure protocol. And so they were withholding care from patients. And I'm not saying that that's bad. It was a best practice of the time. We never really had to move to that because we had this as an alternative. So we would put people in an acrylic box, and we've since the latest iteration of this has an exhaust port on the side, and we pipe it straight into the ambulance exhaust port and creates a negative environment, which is essentially an infectious disease environment. When you go to a hospital and they have an infectious disease room, it has a negative environment room it's not called an isolation room. And so we created our own in the back of the ambulance. Since this, we were able to get into the PAPRs that had been back ordered, which is a higher respiratory protection level for our people, and it negates the need for this acrylic box. But it was a progressive move for us to move into, and getting the training done and working through the algorithm of how do we intubate somebody in an acrylic box when we've never done something like this. But it worked for us. Mr. Brinkley did talk about our hospital liaisons, and the liaison has been very helpful to us and keeps us having real-time information from those hospitals. We got into the healthcare facilities. We have 15 healthcare facilities that provide about 20% of our business. And so we wanted to make sure that 20% didn't grow into 30 or 40%. And so we proactively reached out through email, phone calls, and conference calls to line up what their needs might be. If they had all the information that they required, if they had PPE needs, we lined them up with SetTrack so that they could get the PPE that they needed, because their burn rate's very, very fast. and as well as we had a few hot spots early on, and we arranged through UMMC to have private vendors go in and do the COVID testing. That has since become a priority at the county level. County HHS has done that several times since, but we were one of the first departments to actually make those contacts and connect the dots. We have seen our call volume grow at the healthcare facilities. As a percentage, it went way up, but it's because generally 911 calls went down. Funny thing happens with hurricanes and apparently COVID is when there's a storm in the Gulf, people quit doing stupid stuff and 911 calls decrease. Major accidents reduce, trauma calls go way down. It's like people know like the ER is not the place to be in the middle of a storm, and obviously with COVID, if you didn't absolutely have to go to an ER, you didn't want to go there because that's where the COVID is. And so that worked out for us. Final thing is we did have the governor order the testing of nursing homes, and he put that onto the Texas Fire Service to do, and I think that we handled it better than most organizations could. This is a collective team, a task force from across the county. This is on the inside of the Fort Bend Ambus. We embedded 10 people with Stafford firefighters, Missouri City firefighters, Community Fire Department, and Fort Bend County EMS, along with one or two. That's my timer saying I'm out of time. I had a 20-minute timer on it. Carrie's always very hard on me about my time. So, but we did our part. We went out and tested all of the nursing homes in the county, and we stand at the ready. I actually expected it to come prior, as I thought that the governor would have expanded the order to go into assisted livings, which as a licensee status, there are many, many more assisted livings in Texas, many, many more in Sugar Land than there are nursing homes. And so we have a task force that's already set up. We have the premise worked out, kind of know how it's going to work. And so should the governor change the order, we'll be ready to respond. And that kind of ends my presentation.
Thanks, Chief.
Essentially right on time, Carrie.
Yes. Thank you, Doug Brinkley and Chief Boker. This is very helpful and important information. We're going to go into our question and answer portion of the meeting. Hold on just a moment and I will provide you some instructions as to how you can actually raise your hand in Zoom. Be just a moment. Okay, I'm having a little technical difficulties. So if you all are in the chat portion of the your Zoom box and you hover over your name, you will find the ability to actually raise your hand. It's a blue hand. I'm going to hand this off to Jessica Young. She is going to check to see if we have any questions in the chat box, and then we will move on to the raising your hand option in Zoom. And you are welcome to answer or ask questions verbally with or without your, well, and we will unmute you if you have a question that you'd like to ask over Zoom.
Hey, good morning, you guys. I thought that the chat would light up with all the interesting stuff that Dr. Brinkley and Chief Boker had to say. but it was relatively quiet in the chat this morning. So just for everyone who isn't familiar with Zoom, if you hover your mouse at the bottom of the screen, you're going to have some options at the bottom, and you see participants, chat. So if you can go ahead and click on the chat option, you should see a box show up. And if you have any questions related to the city's COVID response or fire specifically and their actions or PPE or anything along those lines, you can feel free to put those questions in the chat. I'll give you guys a few minutes to put your questions in there, and I will take those and moderate a few questions before we go on to our break. So I'm going to give you guys some time to do that.
This is not like the normal quarterly HOA where we get a lot of questions.
Yeah, well, so we have a few from staff, but I wanted to give the residents a few more minutes to come in.
Carrie, can you hear me?
I can, yes.
I can't believe nobody wants to know what this cost the city. There's always financial questions.
Well, while we're waiting for the questions to roll in, you can go ahead and jump on that and just share with the class.
Well, so for fire specifically, we entered this in a fairly robust position with PPE, but we were very aggressive in shoring up our supplies. And so to date, we've spent about $100,000 in responding to COVID just in fire, and that's not factored in the overall city response or the economic impact. But we were able to shift money. Obviously, when we're suspending community outreach programs, we're able to shift that budget over to PPE. And if we see our call volume decreasing, we're able to shift what would normally be variable cost of responding to calls to fixed cost of overhead for PPE and sanitation practices. So we're able to absorb some of that. And
Thanks so much for that, Chief.
I'll ask what CISM is. That's Critical Incident Stress Management. We have a pretty good CISM team. Probably we have the best in the area. This was started a number of years back. It's headed up by emergency management. But when we ask of our first responders to go and do and see and smell and touch things that no human being should have to. And that's been no different during COVID. We've deployed our CISM team several times to kind of talk people through things. It's the mental health aspect of the job. And Sugarland really does a good job with that.
It's kind of,
we have another. Oh, go ahead.
And Chief Walker, talk about, it kind of started off with the public safety, but you guys are using it quite a bit for other employees throughout the organization. It's been pretty beneficial in that aspect. Can you speak to that?
Yeah, so it started with police and fire, and then dispatch came in very soon after, which is arguably that's a really tough job. It's high stress and high energy, and then it ends when you hang up the phone and there's no debriefing, there's no stress relief. And so probably that's the hardest of police and fire and dispatch. Dispatch has it the hardest. We've broadened that out to other departments within the city that have suffered employee losses. We had one employee that actually passed away at work, and we were able to deploy CISM to help that department kind of work through that. It's a great initial response to identify where we might have some opportunities to help people for the long run.
All right, thank you guys so much. We have a couple of resident questions. One is, did I hear correctly that a permit is required for a neighborhood drive-by?
A permit? No, it's a request. So it's online, Sugarland TX city.gov/fire. You'll see our public outreach page, and you just do an event request, or you can just call us. And the 2 weeks we're a little less rigid than we used to be. Generally, if we hear about it a couple hours in advance, we can make something happen. I mean, we're the only industry in the world that, based off of a single phone call, we're going to bring $5 million worth of assets and about 30 people to your front yard in 4 minutes. So we can probably do a drive-by for a birthday party in a day or so.
All right. And then we have another question that asks, do we expect the long-term financial impact of COVID-19 to be?
I think we're going through that process right now, trying to understand what it means in the city of Sugar Land. I'm definitely not the financial expert. However, we are trending downward in our revenue streams, especially sales tax revenue. But what the impact of our businesses are long term, I think everyone in the nation is still trying to wrestle that and see what it is. The whole team that's really comprised of economic development is trying to figure that out, but also how can we best support some of our business owners to keep our restaurants, our commercial establishments open. Unfortunately, you see some individual businesses who are closed forever and they're not coming back because of the financial strain they have on them. Some of the forecasting, the economic forecasting that the finance department and also ACM Jennifer May is doing is really identifying what that long-term trend looks like, not only this fiscal year, but as we go into FY21, which starts October 1st, and the 2 or 3 right after that as well, too. Typically, there's an economic cycle that really dictates how long that downward trend and the financial impact will be. There's a lot of models out there that talks about the impact. We'll share more information as it becomes available, but we are preparing for the upcoming budget year right now. We're presenting some of the information to City Council will come up very shortly so we can make some informed decisions about how we spend our dollars or our taxpayers' dollars to make sure we provide city services. But there will be some changes coming up in next fiscal year. It's a reduction in some of the services. A lot of it is based on the limited funding that we have coming in right now. As always, we want to be conservative with the tax dollars as we very can. We want to make sure we keep our men and women throughout the organization as best we can. We've never laid anyone off. But also, we have a very high standard of service here in the city of Sugar Land. So we kind of balance those two things as we go forward. So.
That's a great question, and one that's on everyone's mind. Additionally, so with maintaining 6-foot distance, would you recommend wearing a mask also for HOA meetings that are in a clubhouse where you have about 7 to 10 people attending?
Let Chief Booker speak to that for me.
So the science, what we're led to believe by the experts is that the mask does a decent job of stopping aerosol-producing aerosols from coming out as money. And so, like what we do CPAP, APAP, BPAP, innovations, nebulizer treatments. We're creating that environment, so we need a very high standard of airway protection. For the general person, when you're just walking and maybe you're having a conversation and talking, there's very low risk, and so a cloth mask seems to decrease your risk substantially. So I think anytime you're moving in that room, have the mask on. And once you're seated and somebody's sneezing and whatnot, I was at a restaurant the other morning and I felt a sneeze coming on, and man, that you just don't want to sneeze in public at any cost right now. And I'm like fighting this, taking my full attention to not sneeze. But yeah, if you want to social distance and once you're spread out, if there's only 7 or 8 people and you're able to spread out, it's no different than our city council meetings where we have a few people attend. When they're moving in the room, they all have masks on. Once people are settled, the masks come off, the cameras come on, but they're socially distanced appropriately. And then when the meeting's over and the time to get up, masks go back on and they move about.
I was just reading an article this morning that was shared through the email chain. Some of the states are not seeing as high or intense resurgence of the COVID virus. A lot of those states are the ones that implemented masks early on in the process, and they have not seen this resurgence in COVID rates. So there is a significant positive impact for health and safety by having those 6-foot distances, but also wearing a mask, reducing some of the aerosols that Chief Booker talked about. there's definitely a benefit to it. So.
Yeah, thanks for clearing that up, because I know that there's a lot of questions about that, and masks in particular. So obviously everyone is excited about trying to get back to what normal used to be and trying to do our old things that we love to do. And one of those things was National Night Out, and we all had a good time meeting our neighbors. And so one of the questions that we had is, what do we anticipate for National Night Out, and should neighborhoods even begin planning these?
Actually, I'm going to ask Carrie to wait on that one a little bit from a process standpoint or from your public safety.
So that's a great question, and actually something that we've been discussing over the last week in what can be done. I definitely think that there is an opportunity for neighborhoods to get together. I don't know in what way. It may be a virtual national night out, and like many of our community engagement programs, we are reconfiguring how to engage virtually. I, fingers crossed, hope in the next few months we have better news going on as far as COVID numbers, and we are able to get together personally, socially distanced. Selfishly speaking, I'm not in community engagement just to do Zoom meetings. I really do miss seeing everyone, your faces. As many of you know, I'm a hugger, so I'm handing you your breakfast taco at these meetings as well as giving you a hug. So I really hope that we can get together personally in October. It's October 1st, I think. I'll check on that date, but please know community engagement is working on what that plan will look like.
For everyone else, I really asked that question because you always see public facing police and fire, EMS, and you see other departments, but really behind the scenes, coordinate those efforts, making sure everybody gets signed up, making sure we have correct staff on scene, really carry your group. That entire group really brings all that to life. So I really want to carry the weight on that one a little bit.
Yes.
So.
And just to add to that a little bit, so we do coordinate and talk to other cities and their community engagement groups and see what they are doing. And I do know of a lot of cities who are canceling theirs and go ahead and making that call right now. We don't want to cancel just right off the bat. The good thing about community engagement at this time is that it really gives us an opportunity to be innovative and think outside the box. So if that means that we're going to send people to Zoom bomb your national night out, or we're going to send boxes, or we're going to whatever we can do to really make you feel connected to us, because it's really hard to do that sometimes when you can't see each other or be in the same room as each other. So we really are taking advantage of that opportunity to be innovative in this time and just do it a little differently. So.
Yes.
Another question about National Night Out. This is more of a comment. National Night Out is like the Queen's birthday. It can be moved to a more appropriate date. We stage our nights out later in the fall to take advantage of the cooler weather. We can wait until the virus is knocked down. So that's also just kind of thinking outside the box and how to do it. So thank you, David, for bringing that up. You're right. National Night Out is kind of an arbitrary date. We'll make it whatever we want. Who knows?
Yes.
All right. Does anyone have any other questions before we move on?
There's a comment from Mr. Porter on the set track graphs. And just very briefly and very high level, there's an elasticity to COVID that a change in practice or a change in what a county does or doesn't do. There's 2 or 3 weeks later, we'll see a response to that. And so, with the mask order going into place, and the death count, the death rate is very low. The death count is flat, but we wouldn't expect to see a change in that for some number of weeks after the open up. So we see the case count increases 2 to 3 weeks after the state starts opening up. The death count would be very elastic to that. Another month or so is what we were told yesterday. in a conference call with an area hospital CEO. And so I don't want to equate COVID to war, but it really lends itself that in war, the goal is not to kill your enemy. The goal is to maim your enemy, because it takes so many more resources to deal with the injured than it does if they were killed. And that's what COVID is doing. The death rate is very low, but the cost and overhead to treat infected is very high, and that's what ties up our ICUs. And it's very specialized equipment that's required. And there's been a ton of talk about the ventilators and ventilator statuses. It's really ECMO. It seems like it's an external membrane oxygenation where they pull. It's kind of like donating plasma, but in opposite. They pull about 70% of your blood out and they oxygenate it artificially, and then put it back in your other arm. There's not many of those devices around, even though it's an old technology. It's really standing out to be what's helping people. So that laying that curve out flatter really does help in the treatment side.
Right. And then we have another question of, do you still pick up water payments at the box by the post office as well as the one by City Hall?
I'm not sure about the post office location, but we can get an answer that we'll get an answer that before the end of the call. So.
All right, and then it looks like I don't see any other resident questions, but Councilmember Lane did want to ask the group as a whole, and you guys can respond, and I can tell you how to respond. But what she wanted to know is, I would like to ask the group, how many of you view the Fort Bend County dashboard that gives daily COVID count updates? So the way you can respond is if you click on at the bottom where you have the chat box option, you see the participants. If you click on that, you'll see a list of names. You can find your name, select more, and then you can raise your hand and we can call on you if you would like to just show how many of you view that every day. And I can actually put the link. Oh, so it looks like Grail does. Thank you for that. Okay. John. All right. So you guys can continue raising your hands, and Councilmember Lane can see the hands that are raised, just so she can get an idea of how many of you are viewing it. William Sargent would like to know, while everyone else is raising their hands, what hospitals do you use?
Well, we transport to any licensed hospital in the state of Texas as our district. Predominantly, we go to our 3 area hospitals: Sugar Land, Houston Methodist Sugar Land, Memorial Hermann Sugar Land, and St. Luke's Sugar Land. We used to go to Southwest quite a bit. They dropped their trauma designation, and so now our heavy trauma goes to the medical center. And by ground on 90, it's really not that problematic for us. And so we go into the med center probably five or six times a month. 90% of our, maybe 85% of our transportations are to our 3 area hospitals. We'll go to Oak Bend if we have a heightened sense of a trauma problem. Stroke is another reason we'll leave. We'll go to a comprehensive stroke center. We have 3 primary stroke centers in the city, but a comprehensive stroke center will have to actually leave the city to get to. So, but predominantly you're going to see us at the 3. Most EMS agencies don't enjoy having 3 hospitals in their city, especially with a population of 120,000. It's the surrounding population that support the 3 hospitals being in our cities that worked out well for us.
All right.
We have Brian Butcher on. He is with our IT department and can answer the question about the drop box for water payments.
Yeah, good morning, everyone. There are 7 different drop boxes, including TE Harmon, fire stations 4 and 3 and 6, the Sugar Land Police Station, City Hall, and the City Hall Annex. and we pick all of them up once a day and turn them in here at the city, except for City Hall, which we pick up twice a day. So we are still collecting from those sites every day.
Thanks, Brian.
All right, does anyone have any other questions?
Okay, I think this will be we will wrap up this part of our quarterly HOA meeting. I want to thank everyone for attending. I know we got started bright and early at 8 o'clock. Part 2 will begin at 10 o'clock at this same link. So if you want to jump back on about 5 minutes till 10 o'clock, we will get started right at 10. I want to thank Doug Brinkley and Chief Boker for all of their presentations and the important and very helpful information that they've provided us. And again, thank you all for attending, and we will see you back here at 10 o'clock. Thank you.
Sure.
Good morning, everyone. This is Carrie Paxton Lampe. I'm the Community Engagement Manager for the City of Sugar Land. I want to welcome you to part 2 of our quarterly HOA meeting, our first virtual meeting. We're going to get started here in just a moment. I'm going to give it a few seconds to let our presenters jump on.
Oh, I'm on start video.
Well, maybe they're doing something behind you. Stop video. There we are.
Hey, Surrender.
Chief, good morning.
Good morning. Can you hear me?
Yes, I can hear you very well. Thank you. We'll get started in just a few seconds. Just giving everyone just a few seconds more to jump on.
Can you mute me?
Welcome, everyone. We'll get started in about 30 seconds. I see some participants jumping on now. We appreciate you joining us for part 2 of our virtual quarterly HOA representatives meeting.
Weird that I looked through red stuff yesterday when I was in that meeting, and there's like that's not a reported issue.
Okay, let's go ahead and get started. I'd first like, again, to welcome all of our HOA representatives and management company representatives to part 2 of our quarterly HOA meeting. This is the first time we're holding this virtually. If you missed part 1 this morning, we will share that information, either the video and or the PowerPoint slides with you all at a later date, as we always do. We had some good information provided this morning on our response to COVID-19. Part 2, we are going to include, actually there's two parts to part 2. We have our police department update. Chief Robbins and Assistant Chief Michelle Allen will give you all an update. And then we will go right into a Q&A with them. And then following, we will have an update from Economic Development, our 2020 census, our also an update from Treasury, as well as Engineering. And then we will have another Q&A if anyone has questions following those presentations. Now, for those of you who have questions during the presentations, as we get started or we lead on into the Q&A portion, what you can do is enter your question into the chat section of Zoom. And if you wish to do so, all you have to do is hover over at the bottom of your screen and you will see the chat icon, which will then bring up a white box to the right of your Zoom screen, and you can enter in your question there. But we will get to that in the Q&A section after Chief Robbins and Chief Allen are finished. So now I'm going to pass this on to Chief Eric Robbins, and he will begin the police department update.
Thanks, Carrie. Good morning, everyone. Hopefully everyone can hear me and see me well. Of course, I'm your police chief. Been with the city almost 29 years now, so it's a great city. I'm proud to be a part of Sugar Land, but I'm proud to basically stand before you and just give you a little bit of update. I was asked to talk a little bit about some of the current issues, as well as some of our recent policy and tactics as far as what we're doing here at the Sugar Land Police Department. Before I start, I would like to just basically say, of course, a lot of you guys know us and know the police department pretty well, know our command staff pretty well. But from an exciting standpoint, I just made a promotion of one of our personnel. Captain James Davis is actually now promoted to Assistant Chief James Davis. So if you actually see him out and about with a couple of stars on his shoulders, please just congratulate him. So I just wanted to point that out and let everyone hopefully get a chance to see him and give him congratulations. He's been with the department a little over 25 years, so he has a host of knowledge and a wealth of experience. So again, I'm excited about that. As we know, there's been a lot of things happening in our nation, around the world, not only with the COVID virus that's going on, which has changed a lot of the ways that we've been doing things, but also with the more recent incident of the police brutality issues, specifically what happened in Minnesota. We had some issues going on in Atlanta and around the country. We in the police department here in Sugar Land, we're doing everything we can to make sure incidents like that just does not happen. And I'll talk a little bit about that. But one of the things that came up specifically had to do with the protests and the riots. And we've gotten a lot of questions about, what happens when we have these protests. Will the things that we've seen nationwide with the riots, the looting, the destruction of property, will those things happen here, and what do we do? First and foremost, everyone has a right to protest. It is their will and their right to protest. So we welcome that. We welcome that in our city. We've had protests in our city, in our town square, in other parts of our city and locations. So we welcome that. What we welcome also is just a peaceful protest and for people to express their civil rights and civil liberties. So we welcome those kind of things, but we will not tolerate any kind of violence, any kind of destruction of property. So some of the measures, obviously we have 174 sworn officers. So we have a decent force, but for what we've seen nationwide, we probably doesn't have as much support as we need as far as officer on the streets. But we do have a great working relationship with our surrounding communities. I speak on a regular basis with the chiefs of police in this area, and we talk about how we will come together and work as a unit and as a team to address some of these issues. Specifically, Fort Bend County, myself, the sheriff has talked about this. The city of Houston, our surrounding cities, Richmond and Rosenberg. So we all have a mutual aid agreement that if there's a need for us, we will definitely reach out to our surrounding partners to address any kind of need, to make sure we don't have any kind of things that we've seen national as far as the destruction, the rioting, the looting, and that kind of stuff. But what we typically do is we engage our protesters. We try to find the organizers. We meet with them ahead of time. We find out what their wants and what their needs are. And we monitor them and we give them guidelines on what they can do, where they can stand, how they can act and peacefully protest. But we also look for what we consider as anti-protesters, and anybody that's on the opposite or opposing side of their issue or their situation. We find those people as well. We meet with them and we engage them and give them guidelines as well. So we do everything proactively to make sure we don't have these kind of situations that occur. So again, we will not tolerate any kind of violence, any kind of looting, and those kind of things. So we're going to continue. But what I would like to say, of all the things that we've seen going on, and there's a large talk now about police reform, defunding police. Those kind of conversations have been ongoing nationwide. I can tell you right now, we get overwhelming support in our community. We do a lot of great things in Sugar Land, and I think that's part of the reason why we don't feel or don't believe we'll have these kinds of issues. Some of the things that we do, specifically, we're an accredited agency, and what that does is it gives us standards and guidelines that we have to follow. We are very proactive with our community. We have things such as this. This is how we communicate, but it's virtual, but this is how we communicate with our community. We engage our community. We cannot do this by ourselves. We have what we call our Citizens Police Academy. If people out there who have never gone, I encourage you to go. But also with our Teenage Police Academy, we do things, we engage our community, we get input, we ask questions, we talk to them. Our Sugar Land 101, our Mayor's Youth Advisory Committee, all those things are what we're doing that we believe is going to help us and keep us from getting into these kinds of situations. So, but from a defunding police, what does that mean? We've had conversations about it. Lots of people are talking about it. What does it mean for us? We do a lot of things that, that's police related, but also non-police related. For example, we dealing with a lot of mental health crisis, a lot of people in crisis situations under substance abuse, all kinds of situations that's really not truly normal police response, but in times of crisis, people call us. But from a defunding standpoint, are there other avenues and other resources that we can reach out to that can actually respond to these types of deals and types of situations? I think so. For example, we work hand in hand with Texana. We work with our mental health providers. We work with Child Protective Services, Adult Protective Services. These, I think, are organizations when they're talking about defunding, how they can, reallocate some of the funding. I do believe, as we are the first responders, that we're going to be tied to deal with these situations. So more specifically for me, from a police standpoint, I would like to see more funding allocated toward our training to address some of these situations. More officers. The county, for example, they had a crisis intervention team, and it was grant funded. And from my understanding, some of that funding have been decreased, which basically means they have a crisis team, but our officers are still responding to some of these situations, and we have to address a lot of these non-police related type situations on a daily basis. So from a defunding talk, I definitely think that we can reallocate some funding more specifically in law enforcement to training to get our officers in the right positions with the right equipment, the right tools, and the right resources. So I'm gonna continue to advocate for that. Some of the other things that we've done citywide, police department wide, as far as responding to some of these national crises, specifically in police department, we're looking at our policies and our procedures. Like I say, as an accredited agency, we're constantly reviewing and evaluating. Accreditation, it gives us guidelines on policy issues, personnel matters, recruiting, hiring, but also police practices and procedures, for example, uses of force. Our use of force policy, we continue to review it and evaluate it. Right now, we're looking at issues such as duty to intervene, de-escalation. De-escalation is a serious issue that we believe in law enforcement that is really going to assist us in addressing a lot of these situations that we're dealing with. We want to make sure our officers are receiving this type of training. They're understanding about de-escalating situations as opposed to the normal police tactic modes of just simply making arrests. We talk a lot about that. And so that's some of the things that we're going to continue to do. Training, as I said, is going to be highly critical for us. Mental health awareness, social health awareness. But all in all, we are receiving super support from our community. It's hard for us as a police department to even go out and purchase our own lunch in a lot of places. So I definitely want to say thank you to everyone that's out there listening. We're continuously going to engage our community. We don't believe that we can do this all by ourselves, but our job, without a doubt, is to make this city the safest city in the nation, and we're going to keep doing that. We're going to keep providing high quality service, thanks to the support from of course, our community, but also our city council, our mayor and our city council, but also our administration that's also supporting us very, very well to make sure that we have the necessary equipment, that's my job. Everything starts at the top, which is accountability. And I know you guys want a great police force, and so that's exactly what I'm gonna continue to do, is provide you the best service that I can through a lot of various means, specifically as it comes to training, equipment, education, holding our officers accountable, holding myself accountable. So again, I don't want to take up too much of the time because I know there's going to be a lot of questions. I hope there's a lot of questions, and I'll be here for you. And with that, I'm going to ask my Assistant Chief, Michelle Allen, to come up and just kind of give you an overview and an update on the latest crime statistics. Thank you very much.
Good morning, everyone. So today I'm going to present to you, since we unfortunately had to miss out on our March meeting, I'm going to present to you the first and the second quarter crime reports. So if you go to the next slide, please. All right, so just like you've seen in our previous meetings, this is going to be the UCR Part 1 crimes first quarter. So that's January, February, and March. And you can see this year's numbers in comparison to the previous years. So note that we had a really good start to the year there in January. And then obviously in March is where we got to kind of have a little asterisk there because that's when, because of the pandemic, we will have a decrease in our numbers as a result of the shutdown. So if you go to the next slide, and this will be the second quarter. So that is April, May, and June. So you can see this year's in comparison to the previous year. So you can dramatically see the difference in April as opposed to previous years, just as a result of the pandemic and a lot of the businesses being closed. And then you can see as we started to open up a little bit in May, that the numbers started going up, and in June continuing to increase. So that's what we got to continue to keep an eye on for this next part of the year. Next slide, please. Okay, so this is going to be the category that is really going to be driving the decrease in our numbers, because you see there overall in 2019 we had 368 compared to 267 in first quarter of this year. So that's a pretty dramatic drop there. And notice that 34% of those reported cases were in shoplifting. Now, if you go to the next slide and you see in the second quarter numbers, next slide, there we go. So you see it's a 16% shoplifting. So obviously with the businesses not being open, there's just not as much opportunity for the criminals to go in there and steal. And so as a result of that, you'll see that dramatic drop like we have 374 previous time period to 261 in the second quarter. Next slide, please. So BMDs, you'll know this is one of the areas that we really focus on in regards to our proactive efforts. And while we did have a bit of a drop this year, this first quarter, as opposed to the previous years, those are some that are still continuing to occur because obviously the vehicles are outside and accessible to the criminals. So in the first quarter of this year, Telfair was the highest occurrence with 5. And I'll tell you that in all of those instances, all the vehicles were unlocked, and half of those were overnight. So the criminals were in the subdivisions during the nighttime hours and checking for unlocked vehicles. In Costco, those we saw the pattern of the reportees were coming back to their vehicle with the groceries, and then the women would put their purses in their vehicle before they go to the back to start loading up their groceries into the vehicle, and that's when the criminals would come and take the purse out of the vehicle. At the Olive Garden, we saw that in each of those cases, there were backpacks that were in plain view inside the vehicle, and that was the target in those situations. And in the mall, once again, half of the vehicles were unlocked, and one of those was a jugging incident. Y'all remember jugging? That just means that you're being followed from either a bank or a retail establishment. And then when they, unfortunately in this case, parked at the mall, they covered their high value items they just bought by a blanket, but that's not a very good deterrent, especially when the criminals were following them most likely from where they purchased the items. So that's a little bit breakdown of the specifics in the first quarter. If you'll go to the next slide, please. Okay, so for our second quarter, Once again, it's a decrease from the previous year. But in our second quarter, we did see a lot of overnight B&Bs in Greatwood, for example, which is the highest category there, in where 10 of those occurred in one night. In all those situations, the vehicles were unlocked. In some of those cases, there wasn't anything that was actually taken from the vehicles. So that's just indicative of somebody that is walking down the street, trying door handles, and in this case, found 10 of them that were unlocked and made entry into them. Same situation with Covington Woods. It was 10 of those cases in one night that happened, and all the vehicles were unlocked. So that's just a reminder to, even though we are, unfortunately having to stay inside and at our house for the most part, to make sure that your vehicles are locked, and obviously, if at all possible, park them inside of a garage would be a great crime prevention tool. We'll contrast that with the numbers that we see there in Town Square. In those cases, the windows were shattered, and in a lot of those as well, it was nothing that was taken. So just to differentiate between those there. Go to the next slide, and we'll talk about our residential burglaries. And as you can imagine, with a lot of the folks being home, those numbers have dropped significantly. So from 37 in our first quarter last year compared to 22 this year. And you can see that the one distinction that we have is 45% of those is from apartments, condos. So that was a pattern that we had going for a while, of the apartments being either kicked in or the door pried open and entry being made there. But notice the pie graph here, and then we'll contrast that to the next quarter, please. Next slide. So you notice the biggest difference here for the second quarter this year, that 27% of those are from garages. So with everybody being home, a lot of people obviously wanting to be outside any chance they can get. Sometimes they forget to put that overhead garage door down, or to, if it's a detached garage, to lock or secure that door that goes inside there. So just a reminder, if you're out and about and you're tooling around, even if it's a situation to where you have your garage door open, you go into the backyard, just for a short time doing yard work or whatever you're doing. It's a crime of opportunity, and we do have people that are walking around looking for those instances where they can real quickly get in there and take bicycles or lawn equipment or other small items that they can just real quickly abscond with. So see what you can do about securing those garage doors for us, please. Next slide. All right, we'll take a look at our robberies. So once again, as in the other categories, our robberies first quarter decreased 8 last year down to 4 this year. And we did have 3 of those in the commercial area. One of those is a boyfriend-girlfriend incident, so nothing no stranger danger there. The one on the sidewalk, we did have a middle school age child who was on the Dulles Avenue sidewalk walking and reported that a gentleman came up and tried to grab hold of his backpack, and he did not make off with it, but he did leave the scene and we did not locate him. And the other instance in the strong arm robbery in a parking garage, that was the parking area of the Bioskin and Laser on Southwest Freeway, where the suspect did approach a woman who was in the parking garage there and took her purse from her. The other one, the residential area that we had in the driveway robbery, that's going to be on Asbury Park, which is the Travis Park area, in which the gentleman in that case was out in his driveway, and the suspects came, had a baseball bat, and then took the wallet from the victim in that case. Next slide. So for our second quarter, we had a total of 4 robberies. And one of those, remember we talk about these aggravated shoplifting, that they go in there to steal items, in this case from the AT&T store. They went in there to steal some cell phones, etc. And during the theft, actually committed an assault, so that makes it a robbery. In that situation, officers were in the area quickly and did pursue the suspects and managed to capture all the ones involved in that case. On the 3 residential areas, we did have 1 home invasion that was in the Alcar Lake subdivision, in which the suspects made entry through the back door. They did display handguns, and they zip tied the victims in that case. The one in the community park was in New Territory, and that was where the victim stated four suspects approached him and punched and kicked him. The bank jugging, that was on Pristine Way. So the victim in that case went to the bank, withdrew money, drove home. As they got to the driveway of the residence there, the suspects came out, approached them with handguns, and took the money in that case. Next slide, please. So I want to talk to you guys a little bit more about crime tracking, and I believe I've touched on this previously last year, but we have some changes that are coming about. Currently, all agencies in the U.S. are required to report crime to the FBI in a manner which we call a uniform crime reporting method. So that was the information in the first couple of slides that I presented to you. But now the FBI is rolling out a new method, the National Incident-Based Reporting System, or NIBRS for short, that all agencies are going to have to go to next year. But we, of course, like to be proactive here and get things done as quickly as we can. So we've actually started reporting that to the FBI this past November. All right, so next slide, please. So to illustrate the differences between the two, you'll see what we reference as the UCR Part 1 crimes. That's the murder, aggravated assault, sexual assault, robbery, burglary, theft, auto theft, and arson. Those are the crime categories that are being tracked in our UCR Part 1 crimes that are being reported to the FBI currently. And next slide will show you what is going to be the change with NIBRS. All right, so you notice there's a lot more dots on there, right? There's more than almost 3 times the number of categories in the NIBRS Group A that we are now going to be reporting over to the FBI. All right, I'll give you a chance just to read through some of those. I'm not going to read them all off for you, but you'll see it's a lot broader categories there, as well as obviously a larger number. And just to confirm with you guys, this does not mean that we are investigating crimes any differently. It does not mean that these crimes are not already being reported to us. This is just a distinction between the kinds and categories of offenses that we are reporting to the FBI, okay? So our changes or our practices will not change at all. What this means is that the numbers that will be going to the FBI are going to be different. And obviously, since NIBRS has a lot more categories than comparison to the UCR, you're going to see that our crime rate is going to be going up. It's going to be higher. Potentially could be even double what the previous years are. But that doesn't necessarily mean that we are seeing an influx or increase in the crimes that we already have on the books. It's just a different way for us to report them, okay? So what we're going to do, we're going to start giving you some NIBRS information, and we'll also compare with what would have been categorized as NIBRS for previous years. So you get to see the apples to apples comparison. Give you a little bit better understanding of that at the end of the year when we have a complete year's worth of data, and we'll present all that information to our city council as we always do in our annual report, and give it a little bit more of a breakdown for you so you have a little better understanding. But I just wanted to start prefacing that a little bit with you so you start to understand the changes that are coming in the way that we are reporting crime. Once again, no change in the way we are investigating or doing anything on our side. It's just a difference in the reporting category. All right, I'll open it up for questions at this point.
Thanks, Chief Allen and Chief Robbins. I'm going to hand this over to Jessica Young, and she is going to see if we have any questions in the chat section of Zoom.
Hello, good morning, y'all. I thought that there would be a lot more questions about what we've been doing in terms of our new policies and reporting structure. So I'm going to give you guys a little bit more time to put questions in the chat. What you can do is, if you're not familiar with Zoom, you take your mouse and you hover over the bottom part of your screen. There you'll see some options pop up, and the participant that's circled on Carrie's PowerPoint, that icon, there's that option, and if you click on that, you can actually raise your hand as an option, and we can call on you verbally, and I'll unmute you. Or you can also click on the option that says chat, and you can write your question in the chat box. So whichever way you're comfortable, we want to hear from you. So I'm going to give you guys a few more minutes to put your questions in the chat for Chief Robbins and Assistant Chief Allen, and also be looking for any raised hands that I see, and we'll call on you. So I'll give you a few more minutes. I wish I had hold music. I would sing, but no one wants that, so. Man, looks like PD did such a great job of covering all of their topics. Even John says, no questions, but thank you for the presentation. All right, I'll give it one more minute.
Well, I really appreciate all you guys' attention today. Thank you.
Thank you, Chief. And I just want to let everyone know on this call, if you have questions afterwards, we can always forward those on to Chief Robbins and Assistant Chief Allen.
Yeah, and at the end, yeah, Carrie will provide her email address, and many of you already have it, but just in case, she'll provide her email address, and if you don't want to ask questions in a public setting, that's totally fine. You can email her, and we will work to get that answer back to you. So I get it. I also teach a college class, and I get so many questions after class because people don't want to seem stupid asking questions. But I'm all for it. There are no stupid questions. Ask them all. All right. Well, Carrie, it looks like the chat is relatively quiet, and I don't see any raised hands. So I know we're a little early, but it looks like Teresa may be on the call.
Yes. Teresa, I'm just checking to see if you would like to get started a little early with your economic development update. So I'm not hearing from Teresa. She's probably getting ready. We could jump into the census update. Kieran, are you on the Zoom call? And would you possibly be ready to give your presentation early?
Yes, Karen.
Okay, great. All right, hold on just a moment. Was that you, Kieran?
Yes, that's me.
Okay. All right, hold on just a moment, please. All right, thank you, Kieran. You are, I think, at least 30 minutes early, and I have your presentation ready, so just let me know when you'd like to get started, and I can forward your slides for you.
Okay, 1 second. Let me just do that. Okay, I'm ready. Thank you, Carrie. Okay, so it's an exciting day today to do the census update for everyone. Hopefully you've already responded to the census. Originally, the self-responding period would have been over by May, but due to the COVID delays, this period has been extended. So today I just want to talk to you about how we can partner and how HOAs can help us get a complete count in Sugar Land. We do want to cover a couple things in terms of background for the census. I want to talk to you a bit about the census timeline, about the census data, how the data is used, how do you actually take the census, what will happen with your information, and we want to take a look at all the response areas. We have produced a map showing those areas, so I want to spend some time to talk to you about that, as well as what to expect when a census taker come out to your neighborhood. And then I'll wrap it up with how you can help us. Next slide, Carrie. So as I mentioned, all households would have received an invitation around the mid-March period, and you could have started responding at that time. And April 1st is the official census day. However, that's just a reference day. It's a day to remind you, it's a reference point to count everyone living at your house at that time. We're now in phase 2 of the census, which is the motivation phase. And the non-response follow-up will start in August and go through October. And that's when you should expect to see census takers coming to visit your neighborhood. Next slide, Carrie. So how will the census data be used? The census data is usually used to inform decisions on how billions of federal dollars are allocated annually to states, and these are for critical services, including health clinics and hospitals and emergency services, as well as roads and schools. Census data is also used to reapportion House of Representatives seats and to redraw congressional and state district boundaries. They also help to shape our future through understanding how the population changes over time. And on a local level, the census data is really vital to community leaders to help them to build the community and plan for the future. Next slide. So how do you take the census? The census is important and it's simple, it's easy, as well as you can do it online, call in by phone, or you can send it in by mail. It's easy because there's only 10 questions. And these questions, they ask how many people are living in your home as of April 1st. It also asks their age and their sex, and it asks if there are any children living there. So everyone counts in your house as of April 1st. And that count includes all people from day 1 to 100 years old. It includes citizens, it includes non-citizens, it includes temporary residents, long-term residents, and everyone in between. We really don't want to leave anyone out that's actually living here in Sugar Land as of that day. Next. So what happens to your information once you respond to the census? This is a critical question. There are several concerns with the confidentiality of taking the census. And with the fact that we're now taking it online, that also raises concerns. But have no fear, your information is safe. The Census Bureau cannot release any of your information for 72 years. And your responses are protected by federal law. Your answers can only be used for statistics. It cannot be used in a court of law in any way. It cannot be used by any governmental agency. And the census does not share your information. So it wouldn't share your information with ICE, the FBI, CIA, or any other agency. And there's always continuous updates and protections and safeguards as the Census Bureau works with the federal intelligence cyber community to ensure that your information is safe. Next. On this particular slide, I want you to pay close attention to the photos. If a census taker comes to your neighborhood, that's because you haven't responded to the census. So I recommend that you do, because if you don't, you will get a follow-up visit. And the pictures here, they show you how to identify a census taker. For example, they would have their laptops and their bags, as well as an ID card. And in terms of languages, if you do not speak English, you can request a census taker to come back that actually speaks your language, and they would assist you. And if no one is at home, the census will leave you a notice. And the picture here in the middle, that actually shows it's a door hanger. It's labeled Census 2020, and they would leave information that tells you how to respond online, by phone, or by mail. Next. So staff created this map. It shows the low responding areas. And as you see, the salmon color tracks, these are the ones that are lower than our current rate. Our rate right now is at 75%, and these areas are low responding. So for us to really target these areas, we want to get into a partnership or partner with the HOAs to target these areas to help us increase our count. You would have received an email last week from the mayor requesting your partnership and your help. And we'd like you to follow up with staff to create a plan as to how you can reach these areas. Next. So how can you help us? We are very proud to say that we hold the #1 place. We are #1 in the state. I think we're also #9 in the nation in terms of our response rate, and we would like to stay here. And the census, this event, it only happens once every 10 years. So we want you to invite your friends and your neighbors to help us get a complete count. Our goal is really to surpass that 2010 response rate, which was 85%. Our current rate, as I mentioned before, it's 75.6%. So if you can consider looking at existing communication mechanisms that you have as an HOA to spread the word, that would be helpful to us. And some of these ways include emails, postal mail, newsletters, HOA community signs, bulletin boards, your facilities, any of your HOA social media platforms or your outdoor messaging sites. We do have additional resources on our digital outreach toolkit, and that's on the city's website, and we can provide you some more information as to how to use the information in that toolkit. Next, and final slide, just for next steps. We're thanking you in advance for partnering with us. Complete your census now so you can avoid having a census taker come out to your homes. And you can complete that census at my2020census.gov, and you can contact us to make a plan. And the email to contact, that would be myself at kbaah at sugarlandtexas.org. Thank you, Carrie.
Thank you, Karen, very much, and for jumping on early. We really appreciate it. This is very helpful information for our HOA representatives and management company reps on this call. Again, you may all received an email from the mayor in the last week, just reaching out to your area, hoping that we can assist you in the residents there in increasing the response rate from your particular neighborhood. And I would encourage you to please reach out to Kieran, and she can assist you in creating a plan and providing you resources on how to do that. Thank you very much, Kieran.
You're welcome.
Okay, next we are going to go back to Teresa. Teresa Prez is our Assistant Director of Economic Development. Let me bring up her presentation. All right, Teresa, I'll pass this on to you.
Thank you so much, Carrie. Sorry about that, and good morning, everybody. I hope everybody's out there staying safe in this beautiful, warm, a little bit hot Thursday morning. So, at the onset of the crisis, Carrie, can we get on to the next slide, please? Thank you. At the onset of the crisis, the Office of Economic Development, we began kind of laying out the plan as to how we could probably respond to the forthcoming economic crisis that we were anticipating due to the health crisis that was being caused by the virus. Fortunately for us, we had a very strong relationship with many of our major employers, hoteliers, and specialty retailers. So we began with direct email communication, helping them to navigate the various emergency orders and the different offerings that were offerings that were available, and also serving as a reliable source of information. Since then, we have grown this communication into a recipient list of over 1,000 and upgraded to a branded e-newsletter. We also launched a resource page showcasing the many avenues of resources available to our businesses at the time as things were kind of flourishing and blossoming as they came. The webpage has continuously been updated as the various stages of the pandemic have unfolded. We also created a city manager task force to serve as a sounding board and provide outside private business perceptions and perspectives. There are currently 11 members from a variety of different business sectors within our community. And one of the very important documents, or one of the very important actions that we originally took, was to conduct a business survey. And this has really been the driving force in our response to the economic crisis. Carrie, can I get the next slide? Thank you. 300 businesses responded, and overall the results indicated that the top 3 areas of support for our businesses were needing was to be able to reopen their business safely, to obtain financial support, and they sought promotional support as well. With the first 2 areas being covered by the state and federal levels, we focused our efforts on ways to promote and support our local business to help them generate cash flow. In short, what we've heard time and time again from our businesses is that they're not looking for a handout. They want to continue to open their doors safely. interact with their customers, and provide their goods and services. And how we can help them through that is through promotions. Next slide. The All In for SLTS campaign stemmed from what we heard specifically from our businesses. It serves as a unifying theme to demonstrate the determination and really the resiliency of our city. It also showcases how we're working alongside our local business community to create that safe environment for the re-engagement and interaction. It leverages Sugar Land's existing assets, that strong sense of community, to the genuine interest in the collective success for the greater good, to helps us reimagine our community in ways we never really expected that we would have to. We encourage the utilization of this hashtag to show that camaraderie and collaboration, not just from our businesses though, but from our community as a whole, residents, business owners, visitors, if they wish to do so as well. Next slide. As part of the All In for SLTX campaign, the Office of Economic Development also created the Sweet Cash program. The program leverages sales tax dollars to support our businesses and help stimulate our local economy. The benefits of the program include the promotion of our businesses, is a direct infusion of cash flow in some of our businesses. There's also a pay it forward component, which is a development of goodwill in Sugar Land. It helps leverage private dollars to support all of our local businesses. So here's how the program works. Next slide. I hope everybody can see this. I'm actually going to zoom in on my screen right here. So it's really a buy, get, give concept. A consumer such as yourself, your neighbor, your friend, anybody, goes to any Sugar Land business, and this is key, it's any Sugar Land business, and they purchase a gift card from either $400 to $200. Then that consumer submits proof of their gift card purchase online at All In for SLTX. So we take a look at that image, we verify the purchase, and then the consumer is eligible to receive and get a thank you gift card valued at up to approximately 50% of the original gift card value. And here's the bonus part. They also then get to give a gift card. And that's really critical and important to all of this because it's really about supporting our local economy, our frontline workers, and the community as a whole. They will be able to nominate either a frontline worker directly or an entity of sorts such as a hospital, or just allow us to actually help make that selection for them. Regardless, how this whole program works is buying a gift card, getting a gift card, and then being able to give a gift card. All of this, of course, is while supplies last. Next slide. Because our mission is to continue to support our local economy, we're working directly with businesses to amplify their voice and their presence online. We showcase shopping destinations like First Colony Mall and Town Square. We promote new business openings like State Fair. I mean, I personally am very excited about tasting some of those delicious dishes that I've seen online. And then we also share deals, discounts, and promotions. Our overall goal is to help amplify the voices of our business community out to our area. Next slide. So here's how you can help. Really, it's about getting the word out. We created a flyer and I have a small image sample here of it. And then that you can share it either through your HOA communities, to your neighbors, however you would like to do so. And then also sharing the information social. We have a buy, get, give program going online, both at our Visit Sugar Land channels, and then also through our Office of Economic Development LinkedIn channel as well. And then we're encouraging the utilization of the hashtag. If you're being kind to a neighbor, you're all in for SLTX. If you're helping each other out, you're all in for SLTX. Also, don't forget to participate in the program itself. It's really easy, $40. You can get up to $20 gift card, and then you be able to give another $20 gift card to somebody who has been on the front lines fighting this pandemic. We also ask, if you can't do any of that, not a problem. Engage with the business community, like their Facebook posts, comment on how delicious their meals have been in the past for you. Go curbside if you need to do so. Shop online for some of our retailers. Really, it's about you engaging in the community, being able to support each other so we can come out of this successfully as best as we possibly can. Because honestly, we're just really all in this for together. Thank you. Now, can you answer any questions that you might have? Next slide. I think you're muted, Carrie.
Thank you. Sorry about that.
Okay.
We're going to hold our Q&A until the end. If you all have any questions for Teresa, if you could just enter that into the chat box area of Zoom, and then we will get to that in just a few minutes. Thank you very much, Teresa.
Of course, my pleasure. Thank you, Carrie.
Okay, next we are going to move on to Brian Butcher, our Interim Director of IT, and he's going to provide information to you all on a new payment system in Treasury. Hold on just a moment.
There we go. It wouldn't let me unmute myself. I needed the host to do that, so apologize.
Sorry about that.
You ready? All right. Good morning, everybody. My name is Brian Butcher. I'm the Interim Director of IT. I'm going to give you a quick update about our payment system, our online payment system. So specifically as it pertains to paying online with a credit card. So when you pay online your water bill online with a credit card, the actual payment is processed by a third-party processing. We have to do it that way. We've historically used a third-party vendor named Click2Gov. In October of last year, the city was made aware that Click2Gov had a data breach issue. We put out a number of different pieces of information, a lot of feedback, supplied a lot of remedies to folks who may have been affected by that data breach. And in fact, we actually have a whole FAQ page here from back in October. If you have any questions about that is essentially resolved, and that's not really why I'm here today. But just to give you a little background, in October of last year, there was a data breach. Carrie, can you click to the next slide, please? So in addition to taking steps to remedy that one, we've also been working since that time on a way to have more secure environment with respect to online payment. In August of this year, toward the end of August, we'll be going live with a new third-party payment center. We're going to do away with the Click2Gov. We're going to go to a new vendor. It is Paymentus. And I think one of the, it's important that we kind of highlight who Paymentus is. That's why I'm here today. They are a level 1 compliant payment system through the Payment Card Data Security Standard organization. What that basically means is they're the highest level you can get certified with respect to security for online payments. And that was one of the keys that we looked for when looking for a replacement for Click2Gov. We wanted to make sure we were finding someone who is certified as being one of the highest. Now there is some notes to put into this. This change is specific to folks who pay their bill online with a credit card. If you pay with a check, if you come in, if you have automatic draft via check, if you do the drop box, if you do any of the other things that the vast majority of people do, you're not impacted in any way by this. This is just for those folks who use a credit card to pay online. The system that used to process their payments will now be a different, more secure system. Carrie, can you go to the next slide? Real quick. Sorry, Carrie, you go back. There is a website for this, and it's that sugarlandtx.gov/new way to pay. On that website, you'll find all the information, much more than I went into today, about steps to take, FAQs about what's happening and what it really means. I would encourage you very much to go to that website. Right,
and there's a link to that in the chat.
Perfect. Thank you. Go ahead, Carrie. So what does that really mean for our citizens? I want to just highlight what the impacts to our citizens are. Obviously, the more secure transactions. That's the step one. That's the reason for doing all this. Again, it only impacts those citizens who pay their water bill online with a credit card. It does not impact those who do the automatic payment with the check or with your banking account. None of the banking information was ever compromised. It was just the credit card information. If you pay your bill online currently, you log in and you put your username and password just like you pay anything online. You will have to go to our website and sign up for a new username and password through the links on our website that will be in the environment of our new vendor. Similar to the way that you pay your account now, similar to the way you pay your Xfinity bill or any of those online. When you first go on, you log in, you put your email, your account information, and you pay it that way. You'll have to re-sign up there. Also, if you use automatic draft to draft from your debit or credit card, you will have to opt into that and re-sign up for that whenever you go in and do all of that. Carrie, can you move to the next slide? So we're trying to get out there. Again, the vast majority of people don't pay with credit card, but there is a large number who do. So we're trying to get out and get in front of this a little bit. So there's the website that has gone live. We're working on completing a flyer that will give you kind of screenshots of how you go to sign up for the new service and all that. The flyer's not ready because we're still in development for the new site. And until the new site's up and we've tested it and we can't really put the final flyer together, but we're getting close. And when we do, we'll be sharing that via social media, via the website, things along those. Also, the Treasury Department put the link to that website that we just covered on your water bill this month. So if you get your water bill this month, you should see that link on there. Obviously, the people who have automatic payment, they probably don't look at their water bill too much. So that's why we're trying to do this through this avenue as well as social media and on the website. And then also we're working with the folks who are transitioning the credit card services to identify those citizens who have historically used their debit or credit card and reaching out to them directly via email. So that's what I've got. The change is coming at the end of August, and we want to make sure that people who are using credit cards know there is a change, know when they log in and they're asked their old username and password doesn't work or it looks different, that is deliberate. It's an attempt to make things more secure. Summer O'Brien from Treasury is on here, but I in talking and planning for this, I do want to make sure it's very clear that if someone, for example, has the automatic draft, was unaware of this, did not know, and the first month comes and goes and they get hit with late fees or anything because they didn't transition and all of a sudden they went from getting automatic drafted to not getting automatic drafted, and they don't really feel like they should be hit with late fees because we understand, we will work with you on that. Call the Treasury Department, tell them, we'll be able to look and see, oh yeah, you were signed up for automatic draft. This, in September it didn't hit right. We're totally reasonable there, and we will be willing to work with you on a case by case basis. Don't expect that to be very good. That's all I've got, Carrie. I had a question slide, but I think following the protocol, we will hold the questions for later.
Yes, thanks, Brian. Thank you very much. And I also wanted just to reiterate, we will be sharing these links as well as the slides to everyone through my HOA email distribution list within a few days. Okay, next we have our engineering update from Keisha Seals.
Can you hear me, Carrie?
I can, yes.
Awesome.
Hello.
Good morning to everyone. I will try to be very brief, even though it looks like I have quite a few slides. Carrie, next slide, please. So what have we been doing in terms of public engagement through the COVID-19? Hopefully today's meeting is reflective of what we have been doing, which is going virtual. So the ability to be able to keep our residents engaged through the pandemic, keeping you informed of projects that are continuing to be ongoing, still providing timely notifications during construction, as well as still trying to minimize impacts to residents, as well as listening to you and getting feedback from you on things that are impacting you. So hopefully you can see through today's meeting that we've been trying to continue to have public engagement through the pandemic, as well as making sure that everybody is informed. Next slide. So I'm going to step through a few projects that have been ongoing from the time that we last spoke. Derry Ashford, the widening of Derry Ashford roadway is complete. We're just doing a little bit of cleanup on the roadway. However, we are still working on the business park monument signs. Those are underway. You've seen them before, but I'm going to show them to you again just to give you kind of a brief understanding of where the project is or where the signs will be. And we're anticipating that the signs will be completed the end of this fall. So the roadway opened up in February, and now the signs are being fabricated for installation. So this is what you previously saw at the intersection of US 90A and Derry Ashford. You had the big billboard sign, as well as, I'm sorry, next slide, Carrie. Apologize for that. You had the big billboard sign, as well as the smaller signs behind the billboard, which just says Sugarland Business Park. Next slide, Carrie. This is what you will see once the sign projects are completed. So there will be a sign on the west side, which will essentially take the place of where the billboard was, a sign in the median, a smaller sign, as well as a sign on the east side, just welcoming our residents, welcoming our business people, business partners into the business park. Next slide, Carrie. This is just a picture of what it will look like at the night or at night. Just a sign that's lit up on all three sides. So very inviting, very visible to the naked eye, allowing people to see the signs when it's nighttime. Next slide, Carrie. The State Highway 6 improvements, this is the widening of Highway 6, one lane in each direction on the outside. The construction is approximately 50% complete. We are continuing to pour lanes. We are continuing to install sidewalks and curb. We are doing daytime work, which we were allowed to do during COVID because, of course, the traffic was significantly reduced, which allowed us to do work during the day as well as in the evening. We are installing, that should be pedestrian, not pedestrian, but pedestrian poles, are ongoing, sidewalk, etc. And we are anticipating construction to be completed early next year. Next slide, Carrie. The Covington Woods Sugarland Middle School Sugar Mill Relief Line at 7th Street. Construction is about 95% complete. We began construction in June. Replacement of the drainage system along 7th Street, Muirwood Lane, those are completed. We are replacing sidewalk, driveways, and street pavement along Muirwood Lane and 7th Street. Have been completed or will be completed this month. And then the overall project is anticipated to be completed next month. So hopefully all goes well, weather permitting, we will actually be able to open up that roadway completely next month. Next slide, Carrie. Settlers Park drainage improvements. This is the construction. It's about 20% complete. Construction began in March. We completed the storm sewer installation, some roadway, some storm sewer and sidewalks on Mesquite Drive, as well as some on the south side of Greensfield's intersection. We are continuing the reconstruction of the Mesquite and Greenfield intersection. At one point, of course, we were anticipating that the construction will be complete before school begins. So, of course, traffic would not be impacted. However, I'm sure that you probably heard that Fort Bend ISD is going online for at least the first semester of the school year. So, but we still anticipate being complete at the end of August, which is when school would have began. Construction completion is anticipated for early spring of next year. Next slide. So I just wanted to give you a brief update on the parks projects. These are the 2013 Parks Bond projects. We've been continuously moving forward with these projects. There are 3 projects left, with which we talked about a little bit last time, but I just want to refresh your memory. This is the Brazos River Park Phase 2. It's the roadway extension from the Brazos River Park, the new park, all the way to Memorial Park. So it's the connection between the two. So this scope was revised due to the Brazos River erosion concerns last year. And so the design was completed. Construction is anticipated to begin next month. And then we are anticipating being complete and that roadway open up in May, so spring of next year. Next slide. The First Colony Trail is about 3.5 miles of 10-foot wide trails for the First Colony area. I won't go through all the segments, but you can see in green and in yellow and some portions of blue for the pedestrian bridges. It's just a continuation of what we've been doing. We've certainly been coordinating with the residents, holding stakeholders meetings, receiving easements where necessary. The design is ongoing and we're anticipating, it says fall. I'm sorry, Karen, can you zoom up just a little? Or out, I should say. It should say spring 2021. I believe I had sent to Carrie fall 2020, but it should say spring 2021 for construction to begin. Next slide, Carrie. Ditch H Trail, again, this is a phase 1, phase 2 of the trail system. It's about 3.5-4 miles of trail park. Phase 1 is Imperial Park to Lexington Boulevard, and phase 2 is south of Lexington Boulevard to Wood Stream Trail. There are some constraints which we talked about before, but just to refresh your memory, there's some constraints due to the new Fort Bend County Lit No. 2 pump station, which they happen to place right in the area which we were going to do the trail connection. So what we decided to do was just a routing study to determine if it was even feasible, specifically constructability-wise, to still install the sidewalk or the path in that area. And that's the blue section that you see east of the red line. And so we are still wrapping up our feasibility study to determine if we would be able to construct that portion of the network. If not, then it will just stop right at Lexington, which there's already side path on the bridge and comes around to Smart Financial Center. Next slide.
Testing.
So one of the things that we also want to give you an update on is the 2019 GeoBond projects. Of course, the voters approved the projects back in November of 2019. All 4 propositions passed, with drainage having about $47.6 million, public safety and public facility projects, $26.3 million, streets, $10.26, and then the animal shelter at $6.6 million. There's 20 projects identified by residents and staff through the various avenues that we've identified, which is citizen satisfaction surveys, public meetings, weather events, studies, and master plans. Staff is currently working on a projected delivery schedule, which is pending discussion and approval by City Council. So once we have approval by City Council, then those projects will be incorporated into our 21 through 25 CIP project book. Next slide, Carrie. So I'll wrap up with saying, of course, this is hurricane season. June to November. And so floodplain management is super important to us. And then, of course, with our current situation, especially being in the pandemic, go back, Carrie, or forward, I should say, to the floodplain. There you go. Thank you. This is just a brochure. It's actually a 2-page brochure, so front and back. What you're seeing is the front of it, and then the second page that Carrie will show you is the back of it. We want you to have this information. This is good information for you to have in order to protect your property, protect your family, protect yourself and others around you. talk about things with your neighbors, have a plan of execution as it relates to leaving out of your area if you need to. Just have the conversation. So we wanted to provide this to you. We want you to have this flyer so you can send it out to your residents. So again, Carrie said that you should be receiving the PowerPoint presentation. Please send this to all of your residents within your area so they would have the same information that you have. It's extra important that they have any information pertaining to hurricanes and floodplain management. Next slide, Carrie. And this is just the inside of that trifold. So lots of information for you, numbers that you would need if you have any questions pertaining to hurricanes, storms, events that are taking place within our area. Next slide, Carrie. Always, I want to just give you an update in terms of the CIP story map. If you have other projects that you want to see advancing, you want to know what's going on with those projects, you can always go to our CIP story map. I always plug this map because it's a really good interactive tool that we created so our citizens and residents can look at any projects that's going on within the city, those that are active projects. So most of the time we carry about 90 to 95 active projects throughout the year. This helps you see a project from beginning to end, or what we call cradle to grave. Next slide, Carrie. So here's some information that you can get, the city construction notification. This is the website where you can do sign up for all the alerts that we provide for any type of construction notification. Again, always a way for us to keep you informed and keep you connected to what's going on in the city. Then, of course, the CIP story map, that's the sugarlandtx.gov CIP, and then the interactive maps. It provides the project manager, the cost, the update. Hopefully, we're continuing to put pictures up there that will show you the progress of the projects as they move forward to completion. And then as well as the ITS, that's the city traffic website that will give you up-to-date information on what's going on in real time, especially along Highway 90A, where you may have a train passing by and a crossing closed for temporary improvements that Union Pacific does often on their rail line. And so the city traffic website will give you that information. As always, if you have any questions, comments, concerns, if there are projects that you would like for us to look at or issues that you have in your area, you can always go to cityengineer@sugarlandtx.gov. Leave your comment, leave your concerns, your questions. Myself and Jesse Lee, the city engineer, we receive those emails, and so we will always have an opportunity to contact you back if need be. And with that, that is the end of my presentation.
Okay. Thank you, Keisha, very much. Thank you to all of our presenters and for being so flexible. We've have you present earlier than scheduled, so I really appreciate it. This has been very helpful information for our HOA representatives. I'm going to pass this on to Jessica Young. She's going to facilitate any questions you all have.
Hey, so we did have a couple questions, but before I get into those, I just want to reiterate that if you do have any questions, as you'll see on Carrie's PowerPoint, you can hover at the bottom below and you'll see options pop up, and you have participants and chat. So in the chat, obviously, we have a few questions in there and I'll read those. But in addition, if you click on participants, you'll see a screen pop up with everyone in the meeting. And if you just select raise your hand in the lower section of that screen, I'll see your raised hand and we'll call on you and you can ask that question verbally. So it looks like the first question is for Keisha. And let me go ahead. Oh, you're unmuted. Great. The first question is, how will the Ditch A widening by Lid 2 impact the First Colony Trail construction?
That's a good question. We are continuously working with Fort Bend County Lit number 2. If we need to revise our alignment to make sure that that widening is done, because of course the Ditch A widening is very important, we will do so, but we're in communications with, in coordination with Fort Bend County Lit number 2. And so they provided us with their plans. At this point in time, there doesn't seem to be any impacts, but we're always working with them to make sure that that's not the case.
Okay, thanks so much. And now the next question, it looks like it could be for planning. And let me just see if there's anyone on the call. I just allowed participants to unmute themselves in case any of our speakers want to jump in to answer. But this question comes from Roy, and he asks, what is the status of the Imperial Sugar redevelopment? Is anyone on the call? And if we don't have the person on the call to answer that question, we can circle back. And I think I'm looking, I don't think that we have any.
No, I can read. Go ahead, Teresa.
Oh, no, go ahead, Karen.
No, I was going to say that if that question, I can get that question over to our group in terms of Doug Schomburg or Lisa Kuchitmeyer and get an answer, but you can please be free to go ahead.
Well, I just have I've asked this question at every meeting for the last 2 years, and it's been in limbo, whatever you want to call it. That area has just been sitting stagnant during that time. And I would just like to know, because I live in the area in Sugar Mill, and, you know, people get frustrated. They come up with questions, they don't get answered. I just need to have something to give back at least to the people in our neighborhood about when the heck is anything going to be developed there. I mean, pie in the sky is one thing that we've seen, but actual activity, nothing.
Roy, this is Carrie. We can get an update and provide that information to you all.
Roy, to your point, we because that wasn't on the agenda, we didn't have the experts who are supposed to be talking about that topic and who know the ins and outs of that on the call today, because again, it wasn't on the agenda. But we can get to those people and get the answer back to you.
Oh, excuse me.
Yeah.
I guess I'll keep my fingers crossed and ears open. So thanks very much as usual.
Thanks, Roy. We appreciate you attending. Do we have any other questions? You guys can feel free to put them in the chat, or you can use the raise hand function and we will call on you. I can unmute you then so I can see who needs, oh, there we go. All right, looks like we have a question from Weems Turner.
Yes,
All
thank
right.
you very much. I'd just like to thank everybody for taking the time to keep us informed about what's going on with COVID and in the normal business of running a city. And I appreciate it. Thank you.
Oh, thank you so much. We really appreciate your feedback. All right, looks like we have a question from Jim. Jim's iPhone, at least. Is Jim there, along with his iPhone? All right, I don't hear anything from you, Jim. Okay, I'll move along. Do we have any other, oh, I see a hand raised from Jim here. All right, let me check out. We have a question from Roy. He has a question about the city grant program.
Yes, I'm back again. Yes, yeah. I'm back again. We had put in an application for fence rebuild, and then this COVID crud came along, and so we knew that we could not take advantage of that because we could not sign a contract or start work until we got approval or action on our attempt to get a grant. We had to back out because we had to start because our fences were in pitiful shape. And so I informed Ms. Williams that we would have to back out. And I'm just concerned because of this COVID crisis, the chances of monies being available next year because of, increased spending by the city with all the this emergency stuff going on and so on. And just want to know, like I said, if the monies would probably be available again next year so we can try one more time. Thanks.
Thanks so much, Roy. We will write that down, and I'm taking notes over here, so we will circle back to you on that one.
Thank you very much, Carrie. You've been a great help with this, as has Ms. Williams, in getting this grant application in and responding to all my emails. Again, I greatly appreciate all your help.
Oh, you're very welcome.
We love all of the emails. We have another comment or question from Ralph. He asks, Carrie, did I miss your comments regarding the issue of PowerPoints of the presentations?
Oh, hello, Ralph. I hope you and everyone else on this call are doing well. I'm seeing your faces. Yes, I will share, as always, the PowerPoint slides and the links that have been shared in the chat, as well as hopefully this meeting video with all of the HOAs on my email list. So that should be coming in the next few days. So yes, you'll definitely be receiving this information.
All right, so to recap, you guys heard a lot of information today. You heard from about COVID-19, you heard about our police policies and our crime updates, you heard from Teresa Pezza about economic development and how we're helping businesses and trying to boost back the economy. You heard about the census and Treasury and our new way to pay, and a few engineering projects that we have going on and the status of those. So do we have any questions, since those people are on the call and they can speak directly to those? So I'm going to give you guys some time because I don't want us to end the meeting early, which let's all just give ourselves a quick round of applause for what I like to call Y5s. We just give each other a Wi-Fi for being early. That's always nice. So
Thank you all.
Thank you. I'm going to give you guys a few more minutes to put questions in the chat and also take advantage of sorry, I'm motioning over here as if you can see my multiple screens, to take advantage of the raise hand function, and I'll unmute you and you can verbally ask your question if you prefer to do that. Otherwise, I'll be looking at the chat to see any other questions. Hey, Jim. Jim? Oh, I hear something. Oh, all right. But you just hop on if you speak out if it starts to work for you. John, thank you so much for your feedback. I'm glad that this was informative.
I'm going to go ahead and share my email address. I think most everyone has it, but just in case, if you have any questions following this meeting, of course, as always, please email me and I will follow up for you. And also, please save the date of October 15th for our next quarterly HOA meeting. We're not sure, of course, what that will look like, but I will let you know as soon as possible. And also still be looking for my updates weekly regarding COVID and all the other topics that I email you so often about. So.
Hey, Jim. So you're not muted on my end. You can feel free if you wanted to ask your question in the chat. I can relay that. While we're waiting on Jim's audio to kick in, does anyone else have any questions? We really appreciate you guys hanging out with us. This is a long meeting, and you guys stuck in there like frickers, so we really appreciate it. And we just we had so much to tell you guys, and we couldn't wait to tell you, and we just wanted to fit it in so that you all didn't have to break it up into days. So we're glad that you guys hung in there with us. All right. I see. So, Jen, you had need a contact to repair a large section of sidewalk on Ninth Bridge. What I'll do is Keisha, did you want to say something?
Sure. You probably were going to say the same thing, but we can provide him with Public Works email address, Eric Oscarson, as well as his contact information. Mm-hmm. And he will be a great resource for having someone come out and look at the sidewalk and then making the necessary repairs when they can.
Okay. And Jim, I have your email address. I will email you directly with that contact information. Thank you. I see your comment in the chat.
Perfect. Great.
Yes.
Okay. Anything else? Going once. Going twice. All right, Gary, I think that's all the questions.
Okay. Thank you very much, everyone. I really appreciate your time. I appreciate the time in preparations of the presenters. You'll be hearing from me via email. Feel free to call or email me if you have any questions, and I hope you all stay safe and have a nice weekend. Thank you.